So, Anjali, what's changed in the 33 years that you've been doing IVF?
Of course, technology has advanced so much that when I started, I think our success rate was just about 5%, 6%. And today the success has gone up to 40 to 50% for a single cycle. And if you take the cumulative success rate, it reaches almost 80 to 90%. Cumulative means if the same patient continues cycles for about 4 cycles or 5 cycles, there is a 90% chance that she'll get pregnant. So along with technology, I feel a little... Along with technology, I also feel a little bit the awareness has also increased. Though it's a stigma, I think the awareness has increased. So when I used to see patients years ago, the couple would come, or the mother-in-law would typically come and say, "Isko bachcha nahi ho raha hai." And I would look at the husband and say, "To aap kya kar rahe hai?" But today it's changed. The mother-in-laws bring their sons and say, okay, he may be having a problem. Or sometimes even men come on their own, boys come on their own. And another level, because probably their girlfriends have pushed them and said, do your sperm test, even before marriage. So they are doing that test. They are accepting that it could also be a male problem. If you see statistically, 40% of the time it's a woman's problem, 40% of the time it's a man's problem, 20% it's a combined problem, and 10% is an unexplained. Very few men know this, but today I think they're accepting it, so that's a big change. And the other thing is about social infertility. What I've coined this word is social infertility, whereby young women are now having infertility, maybe due to men and women, both of them. The sperm counts are going down, and the egg quality is going down. Probably because of lifestyle changes, probably because of pesticides, probably use of plastics, obesity, we don't know what the reason is. There's something called social infertility which is accepted because women now, girls don't want to get married early. They want to get married at a later age. Even if they get married, either they want to pursue their careers or they want to, climb the corporate ladder, or they just want to have fun. They just want to travel and nobody wants a baby. But what happens is fertility starts declining at the age of 30, 35. Your peak fertility is at 20 to 30. And as you reach 35, the egg quality goes down and the number of eggs goes down. So even though you look healthy, you're eating the best of the food, organic food, whatever, from wherever in the world, your eggs don't know that. The egg quality does go down. And that's why the best time is to have a baby around the age of 30, 32, 33. And if you don't want a baby, then what young girls are coming is they're coming in freezing their eggs. It's a very easy procedure. You have to take hormonal injections for a few days. We do the egg retrieval and keep the eggs frozen. The eggs can survive for 10 years, 15 years. So if they want to have a baby, they have a baby. If they don't want, that's fine. So a lot has changed in this a few years.